Hello, I'm Kim Wulf, the Director of Radiology and Cancer Center Services here at Nacogdoches Medical Center. Today we have Dr. Luke Burton, one of the radiologists here. Welcome.
Thank you.
Dr. Burton, would you like to tell us a little bit about yourself?
So actually this past Saturday, my wife and I, Shannon, celebrated 28 years of marriage. We have 4 kids. My oldest son just got married in June. I have 2 daughters at Texas A&M, and then my youngest son is a sophomore in high school.
Can you tell us what your favorite thing about radiology is?
I like a lot of things about radiology. I've been doing radiology now for about 20 years and I still love it. I'm probably one of those nerdy guys that loves looking at shapes from different perspectives and trying to figure out what it looks like. So I kind of think it's a little bit like architecture, but of the human body. Oftentimes has the answer to the question, and I like giving the answer to the question.
In the radiology world, is there anything that you wish you could change?
Oftentimes radiologists are kind of considered the guy in the back cave and we don't get out much. I think sometimes I wish that there was a little bit more interaction. I do love helping all the different types of physicians help patients, and so I like the part that we were sort of a consultant to a lot of different physicians, and so that's one of my favorite parts. I think in today's world, especially in teleradiology, and to patients, when they get a report, they see a name on a report and they have no idea who we are. I think a lot of our referring docs don't know who we are. So I feel sometimes like maybe we're a little bit left out of the team, but other than that, that's probably it.
Do you have a favorite study to read?
I think just reading an ER abdomen and pelvis is one of my favorite things, just because oftentimes we get that answer and it's always kind of like opening a present and finding out what you get. And so I kind of like that aspect of it. Radiology is kind of a combination of, the finding can be obvious, and it's what do you do with the finding, and you have to list a bunch of differential considerations, but the finding is blatant. And then there's the side, kind of like in mammography is a perfect example, where it's almost like, where's Waldo? And you're trying to find something that maybe is difficult to find. And so I actually prefer the, can you make the finding aspect over the, what do you do with the finding?
When you're not doing what you love, which is radiology, what can we find you doing?
I love doing lots of different things. I love being outside. I'm a pickleball addict, so I love to play pickleball. I love to play golf. My younger son's on the golf team. We play a lot of golf together. Love to hunt, love to fish, basically be outside.
Tell us something special about Nacogdoches Medical Center.
I definitely feel like the people are my favorite thing here. This place is just very family-oriented, feels like a team. I love all the people, from administration to all the techs to people that work in the cafeteria. I mean, it's just a great place, very family-oriented, and it's just fun.
Thank you, Dr. Burton, for being here, and thank you for tuning in to another episode of Ask a Nac Doc.